Welcome back to Rumblings, the Chess 2025 podcast, everyone. I'm your host, Sandy Karana, chair of Chess 2025, and we're getting ready for another exciting day, the final day at the Chess annual meeting here in Chicago. So today we're going to look ahead to Wednesday, and joining me is my dear friend and colleague, Dr. Amy Morris, who is the chair of Chess 2026, which will take place in beautiful Phoenix, Arizona. Amy, it's so great to have you.
Thanks for having me, Sandy.
So, Amy, before we get started, I just want to mention tomorrow is the last day of the exhibit hall, right? And exhibit hall, it will be open from 10 a.m. to 2:30 p.m. Have you had a chance to make your way down there? Yeah.
Absolutely. Yep. Fun activities happening down there all the time.
What was your favorite?
Well, I am a big fan of Bill Kelly and all of the games that he puts together. There have been a number of activities. That's the most recent highlight. So I'll stick with that for the moment.
Okay, great. And you know what? I love stopping by the Experience Chest area, the store. I love bringing some mementos home. Just wandering through the exhibit hall, I just take away, it's almost a glimpse to the near future, to what's coming next. I know that the presenters always appreciate with people stopping by, looking, inquiring about the research or what they're presenting. Do you have any tips for our attendees?
Yeah, and this is I think the heart of chess is bringing up the next generation of providers, right, and encouraging them on their journey. And one of the best ways you can do that is supporting them in the case reports and rapid fire sessions, alongside, of course, learning for yourself. There are great nuggets of education every time I stop by a session, a poster session, or a rapid fire session. And I would encourage everyone to take a look at the schedule ahead of time, target some posters or rapid fire session that you find interesting, but then keep yourself open to what attracts you in the moment. And you may find that there is something very interesting you had missed when you're scanning through the app. And you're encouraging a younger trainee along the way who is going to love to have you stop by and ask questions. So stop by a poster, look for a trainee who doesn't have anyone at their poster at the moment. Say, hey, can you walk me through it? You will make their day and help them on their way in their training, and learn something while you're there.
Love it. I think you said it so well, Amy. And I want to take a moment to thank you for all the support you've given me and the program committee to putting together this meeting. And as we're wrapping up, I am so excited to start planning or see the planning go forward for Phoenix. So I want to hear all about what you're thinking. What do you want to share with our attendees for the excitement for next year?
Well, I've been thinking about this a lot. And, when I think about why do people go to chess, there are two big reasons. One is you want to learn, you want to be a better doctor, better provider. And there is a lot to learn all the time. Two, though, is to be in community with individuals who share some of your passion for science, for physiology, for patient care. That social element of chess is not just fun, but nourishing for the soul, at the risk of sounding melodramatic. And and I think we need that. And coming to chess, I think, is a way to build the adaptation and resilience that is required to flourish in a challenging landscape. And being together to learn, to be in each other's company, and to have that sense of community, I think is essential for us in medicine right now and science. And we're hoping to build a meeting that is academically rigorous, that is allows us to look forward to the horizon of this challenging landscape, right? Medically, scientifically, um, but is also good fun.
That sounds amazing, Amy. And Phoenix is such a beautiful city, warm weather, great food, eternal sunshine. So, when, as you're thinking, I mean, for all of us who are looking forward to being in Phoenix, what should our attendees be thinking about as they're looking ahead to Chess 2026?
What I really want to center folks' attention on is the scientific advancements that we are seeing in a number of different specialties. We've seen a lot over the course of chess just this year. Every year there are new things coming down the pike in pulmonary hypertension, in bronchiectasis, in all of our fields. Let's be clear, and I expect that next year we are going to have scientific discoveries and clinical advancements to explore just as we do every year. And that's really where we're focusing our attention in terms of the content of the meeting is what are we seeing on the horizon? What's coming in clinical practice? We always focus, always, on what are our best practices now. That is a huge part of the meeting, yes. But I find that our more senior clinicians and providers, in particular, are very interested not just in what are best practices now, but what is coming down the pike.
And that's great guidance as people start thinking about developing sessions. And correct me if I'm wrong, but I think the submission site's going to be open pretty soon, isn't it?
So the submission site is open now, actually, and
Okay.
while thoughts are swirling in your head of what you've learned these past few days, now's the time to put those thoughts together, put them on paper, and start developing sessions for next year.
Well, Amy, thank you so much for joining me, and congratulations on leading Chess 2026.
Thank you, Sandy. Thanks for having me, and congratulations on a fantastic meeting. And I've had a wonderful time these last few days. I'm sure everyone has. I've learned a ton. I always do. And looking forward to next year in Phoenix.
Me too. Me too. Thanks, everyone, for listening. Enjoy your Wednesday at Chest and safe travels home.